So at Path, you're working with a broad range of partners in terms of initiatives and product development. What sort of innovations should the global development community expect 3, 5, 10 years from now? What should be on their radar?
Yeah, you know, it's one of the things that's really exciting at your conference here today. We're just seeing some of the amazing leaps forward with technology and people are just starting to touch on some of the possible applications, and there's so many more that to be thought about. I think what's also been highlighted a lot today is innovation is happening everywhere. It's not just happening in the in Silicon Valley or in the well-funded, pharmaceutical companies. And it's one of the reasons why, at Path, with support kind of from a number of key partners, we did an effort to reach out to the world and crowdsource what were some of the innovations that the world felt would have real value for achieving the new Sustainable Development Goals. So by 2030, what were some of the innovations that we thought that could come and apply to those health targets? And so we put together this Reimagining Global Health, which was crowdsourcing innovations from around the world. Roughly 30% of them came in from low-income countries and entrepreneurs in those countries, and then using experts around the world to make panels and say, which ones did you think were going to have some real potential? And let's showcase those and make sure people are paying attention.
And talking of application, how does it apply to the new context of the Sustainable Development Goals, these global goals?
Yeah, well, it was very interesting at when the Sustainable Development Goals were launched, and even at the special meeting they had on the financing of the Sustainable Development Goals, innovation was sort of a big component. And when people are saying innovation, they're not just meaning the brand new widget. Often it's about what's the smarter ideas to ensure access, to ensure affordability, and to ensure sort of effectiveness of the solutions. So for example, something like this, right? Ciena Press. 220 million women do not have access to contraceptives that wish they had access. And we know from interviews with women that long-acting injectables are one of the choices, the favored choices that they have, because they're discreet, because they're convenient, because they last for 3 months, and all the rest. But a lot of women don't have access because to date it's been only something that's delivered in a facility, right? That they'd have to get to. You need the needles, you need the drugs, you need the health worker, you need the woman to kind of walk 5 kilometers and get there. So, so there was a problem, right? And so again, doing a review of what's out there and saying, we already have long-acting injectable technology. Can we change how it's packaged, right, so it becomes more accessible? So then it was a combination of Pfizer with the Depo-Provera, Becton Dickinson BD with this Uniject, which in fact Path created decades ago, and combining that with some extra, some new formulation of the drug, so that now you have this super simple device that comes out of the health facility, can be given to the woman by a health worker, a community health worker, and in some places, what's being tested is even to have the woman self-inject, right? And that's already been approved by the EMEA in Europe and is being sold in the UK. So, it's a game changer, not about a brand new widget, but all about the access. And that's the kind of thing that people were very excited about.
So in your experience, there's not a lack of good ideas and innovations, but what are some of the obstacles perhaps to bringing some of these ideas to market?
Yeah, one of the biggest challenges is the word market. What defines a market, and what's going to create the incentives or even just the economic viability to enable sort of people to invest to ultimately get it forward. And so more attention on understanding what that market is, getting better data, and getting partners who can provide that data to the table is a big part of the solution.